Welcome back to my diet and pain video series. Let's talk about neck pain. My first considerations with chronic or recurrent neck pain and injuries, outside of the muscles, bones, and ligaments from a functional health perspective, are blood sugar fluctuations, food allergies and food sensitivities, and emotional stress. Please keep in mind all of the info that we discussed about stress and how it impacts our ability to heal and stabilize joints. Fluctuations in blood sugar have many impacts on our health. I'm going to discuss two common impacts of abnormal blood sugar on the neck: disc problems, typically around the fifth cervical vertebrae, and anterior head carriage related issues. With disc problems, the first consideration should be the postural muscles of the spine. Chronic blood sugar abnormalities create stress on the parts of the brain that control the postural muscles of the spine due to deficient availability of fuel. This can be related to anemia and other factors related to oxygen intake or transportation as well. That being said, the deep postural muscles that are primarily responsible for postural stability are not consciously controlled. Therefore, even if you exercise and work toward improving your posture, if you have chronic blood sugar abnormalities, your deep postural muscles may be negatively impacted, resulting in pain and over time disc problems. This happens because the spinal joints are first protected by the muscles that move them, then the ligaments that hold the bones together, then lastly the ability of the bones to withstand stress. Chronic blood sugar stress negatively impacts the function of the postural muscles. This increases the strain on the ligaments that hold the inner vertebral discs in place. Over time, the increased strain on the ligaments weakens their integrity and may result in bulging or ruptured discs. This may result in pain that radiates down one or both arms. Stabilizing blood sugar should always be at the forefront of any plan to improve symptoms related to chronic neck pain. Anterior head carriage can generally be described as when the head is positioned so that the ears are in front of the shoulders from a side view. As with disc problems, the compromised deep postural muscle function will allow the head to naturally move forward. This position is not ideal for distribution of the weight of the head on the spine, and over time it will result in bone growth or spurring to support the abnormal positioning of the head. Once this happens, making changes to the posture becomes extremely difficult, but reducing pain is still possible. The next common agitator of the neck muscles can be related to immune stress, most commonly from food allergies and food sensitivities. When proteins in certain foods react with specific parts of our immune system, it can create reactions commonly known as food allergies and food sensitivities. With the neck, common sources are wheat and dairy proteins. Reactions with wheat proteins like gluten may have a negative impact on our stomach muscle function. This may increase the strain with forward head movements like looking down or coupled head movements like turning your head from side to side. This subtle connection is often missed, but the kinetic chain of movement of the head may be significantly impacted by issues with the stomach or abdominal muscles. Dairy proteins like whey or casein can affect anterior or posterior muscles of the neck. This may result in many types of neck pain and even headaches in the back of the head or above the eyes. It's not uncommon for these patients to suffer from other problems like chronic sinus issues or have a history of tonsillectomy or appendectomy. With food allergies and food sensitivities, avoidance is the first step, followed by reduction of the inflammatory processes related to these immune responses. Next, persistent emotional stress may have a negative impact on the muscles related to the neck. This is very common with neck pain that begins after normal or benign movements. This could be sleeping wrong, turning your head, or any number of minor activities that should not cause your neck to tense up or go into spasm. Persistent emotional stress will increase ligament flexibility, which can increase the force of stress applied to the ligaments that support the spine and disc. Again, remember that joints are first protected by the muscles that move the joint, then the ligaments that hold the bones together, then lastly the ability of the bones to withstand stress. Since the neck is the portal of communication of the brain down to the rest of the body, if the bones have too much joint play, the risk of decreasing blood flow to the brain and damaging nervous system communication increases. To protect you, the neck muscles may go into spasm to prevent instability and decrease this risk. Of course, this comes at the expense of many normal daily activities, but it does serve the purpose of preventing the serious negative impact that lack of blood flow to the brain or nervous system disruption would have on your ability to live. To tie it all together, if emotional stress has been high, the ligaments that hold the bones of your spine together allow more joint play. If you combine this with suboptimal muscle function from blood sugar abnormalities or from immune stress, you begin to create an environment that will be more prone to neck pain. Of course, there are other muscles, organ systems, and adaptations to stress that may influence the function of the muscles related to the neck. However, these general categories have a substantial impact on neck muscle function and pain that will help build on the information that I mentioned in my other videos. I've created an online course called the DIY Health Assessment Course. It will help guide you through the steps I take with patients to help them take their health back into their own hands. This course gives you a quick and simple way to organize your symptoms and lab results in a way that will help you understand what changes you should make so you can recognize and reduce the stress you didn't know you had, so you can begin the journey of decreasing pain and improving function. Also, if you want a quick reference source to help you make changes to your diet and lifestyle, check out my book, The Path to Health, a manual for proper care of the human body. Don't forget to like and subscribe to help make sure that you can stay up to date on my videos and help the algorithm move more people toward this information so that everyone can be more empowered to help themselves and to escape the grips of our current healthcare system. Thanks for your time, and I hope this information helps broaden your perspective on how diet and lifestyle impact your pain, your ability to heal, and that it helps you get on your path to health. I'm Dr. Richard L. Robles. Thank you.